Good morning once again. So as we wait for the others to join in, we'll just play some two short videos.
As a developer, I realized ClickUp is an incredibly powerful engineering tool. I wish I knew sooner.
Systems thinking means understanding how systems are interconnected, as well as understanding the dynamics within systems. A system is a configuration of parts connected and joined together by a web of relationships, or networks. Systems thinking is nonlinear. This means that in systems, cause and effect are not necessarily linked or connected with simple step-by-step chains. Connections between human and natural systems are of particular interest because they offer excellent examples of cascading effects. Cascading effects means that what might seem to be a simple outcome of a given system can actually have a series of effects on other interconnected systems. Let's consider the following quick example of systems thinking. When looking at a hot dog, you might see a delicious ballpark fan favorite. However, have you ever considered how many miles, steps, or networks it takes to produce a hot dog with all your favorite toppings? Think about all the unique steps that are involved in producing just mustard. Mustard seeds come from India, and some of our favorite fancy mustards are prepared in France. Beyond the mustard seeds, mustards require turmeric, also made in India, and paprika from Hungary or the Netherlands. In addition, salt, water, and white vinegar are also needed. Considering the system that is involved in producing simply one condiment can be complex, let alone thinking about the entire process that is necessary to produce a fully loaded hot dog. People are not particularly well equipped for systems thinking. It's much easier to understand and interact with simple, linear cause and effect chains. The more complex the system dynamics, the more difficult it is to know how decisions will play out. Oftentimes, decisions or actions at one point have an impact on another component within the system. For example, thinking about our ballpark hot dog, if mustard seed production is decreased by warmer weather patterns one year, then the price for this key ingredient is likely to rise. This, in turn, could limit production, making mustard seed more expensive and/or not as readily available. Within systems thinking, it is important to see the interconnected nature of all the elements and to understand that reacting to a problem in one part of the system may have unintended consequences on other components or the process as a whole. Systems thinking does not claim complete knowledge. Rather, systems thinking is about assessing the degree of system complexity, analyzing system dynamics, and making decisions that reduce the risk of negative outcomes. To develop systems thinking, explore how things might change under different circumstances. Look at possible associations and connections beyond the information that is being presented. Consider conducting an institutional analysis, which includes a robust review of existing practices, mechanisms, and procedures currently in place. Share your findings with relevant stakeholders and discuss both hidden and visible flows. Seek possible explanations and relationships. Think more globally about how you are part of major economic, environmental, and social systems. Consider how these systems directly impact one another and how they influence the immediate systems you work within.
Good morning once again to everyone, and welcome to this session today. And before we start, can we have a volunteer to pray for us?
Let's pray. God, our loving Father, we thank you very much for keeping us throughout the night and bringing us to another day. We ask that you guide our facilitators, you help our students to report to the class, help us to understand the system thinking that we are going to learn today, so that we are able to develop a project that help us to develop and to give a good results. I ask that keep us healthy. We have started in the previous month and we are almost coming to the end of the period. We thank you very much for guiding us and keeping us alive up to today. May you lead us, may you guide us, may you give us the wisdom to understand what we are going to learn. And I ask this through Christ our Lord. Amen. In the name of the Father, the Son, and the Holy Spirit. Amen.
Amen. Thank you, Alex. So before we get into the exciting session for today, we'll just quickly look at the session that we had last week, just to have a quick recap. So last week, we did have a session where we looked at research and policy in AMR. And today I would like to just ask from the floor, anyone to volunteer to just give us a key takeaway. I would want one lady and one gentleman, just in the spirit of being gender sensitive, to just tell us what do you recall from last session. So anyone volunteering to do that for us? Any one thing that you learned last week? And I'll give the floor to a lady first. Is there anyone who's willing to just tell us quickly anything that you recall from the two presentations we had last week on research and the other one on policy? Do I see anyone's hand up? Or do I nominate someone? Let me just see which ladies are in the house today. Anyone willing to share? Sheila, any key takeaway from the last session, the session last week? If you were present, or I don't know whether Sheila can hear us. I can see Ruth as well. Anyone willing to say something, even from the gents, if the ladies are not willing to share, or if they are not in a position to say what they, from last week's session, what we learned? Anyone? Were we all there last week? Oh, I think two people have raised their hands. Let me just see.
We have 3, Julian.
All right. Okay. So
Yeah.
we can start with, I'd said ladies first. I think I see Michelle. Michelle has a hand raised. Or did it?
Yes. Can you hear me?
Yes, we can hear you. Thank you.
From the research session, I got that there's still a lot. The non-country.
I think you're breaking, Michelle. I don't know whether it's from my end only. Can you hear her?
No, she's breaking a bit.
Michelle, I think you're breaking. Kindly put in the chat the contribution that you want to give us. Michelle, if you can hear me, just put in the chat what you wanted to say, because it's not you're breaking. Who else do we have with their hand raised?
We have Shamim and Brian.
Okay, I can just give the floor to you quickly, Shamin.
Shamim.
Okay, good morning, everyone. What I remember about last time's session, we looked at the public health approach to research, where we looked at the surveillance, the risk factors. Like if you want to conduct research, first of all, you have to find out what is the problem. Then you find out the cause of the problem. Then after finding the cause of the problem, you go on to find out which interventions may work to solve the problem. Then you go on and implement the problem. Then another thing we looked at the universal pledges to AMR, where you only have to use antibiotics when indicated for the bacterial infection. You have to wash your hands before eating or preparing food, or you should wash your hands after sneezing. So that's what I remember. I'm remembering in universal plagues. There were quite many, but I'll say a few. Then in public policy, we said public policy, what I could remember, they said they are a set of decisions. They are authorized by the state and they are intended to achieve specific goals. So that's what I could remember from the previous session. Maybe we can get another person.
Great. Thank you so much for that excellent recap, Shamin. Brian?
Okay, thank you so much, Julian. I just wanted maybe to add on what Shamim has said. First on the side of research, and we realize that we have a very big gap in Africa, like in low and middle income settings. There is we have a lot of problems, but there is little research on those problems surrounding us. Yet we need a lot of solutions which can only come through research. So there was a realization that we need to do more of research and identify our problems that we can inform policy formulation, and yeah, it was like a call on to us. And then on the side of policy, the one thing I got was that in policy formulation, we have a part to play in advocacy. Like we can advocate for things after being informed, then we can advocate and inform policy making and formulation. Yeah, thank you so much.
Great, thank you so much, Brian. So in the interest of time, we can just put in the chat the other participants who had raised their hands so that you can just put your contribution there. So today, we have quite an exciting session where we are looking at design thinking and systems thinking in AMR. There were some resources that Daniel shared that you were supposed to go through, videos and some links. I hope we managed to do that because this will be good for us as we get into the breakout sessions. So we do have, I'm very honored today to have a guest, Diane Parak. I hope I'll pronounce those names correctly, but it really motivates me because she's such a young leader, but doing so much in a setting. And we'll hear a lot from her today in her presentation where she'll actually take us through what she has been up to. And it's good to see that I'm sure today you relate to someone who's almost your age that's doing a lot of things, and I'm sure you'll be very inspired and motivated to act as well. And remember to put your questions in the chat as we continue. And also, I I think just take note that we'll have breakout sessions after this. So without wasting much time, I'll just introduce our guest because she has to leave soon after a presentation. She's got another prior arrangement for today. So Diani Parekh is a product design graduate from the National Institute of Design in India. She'll be speaking today about a graduation project on mitigating AMR, a systems thinking oriented project to prevent diseases in poultry that won the RSA Student Design Awards in the redistributing health category. Apart from that, she has been associated with organizations that work around AMR, including REACT. I know she was actually quite instrumental in actually helping one of the nodes for REACT, REACT Asia Pacific, in actually designing and working on a toolkit for biosecurity for poultry. And she's currently based in Goa, India, as a design research associate at the Quicksand Design Studio. Her work doubles around researching design methods and systems thinking to facilitate a positive behavior change around social innovations, which is something very, very important in antimicrobial resistance. So over to you, Diani. The floor is yours. Thank you.
Thank you so much, Julian. I'll share my screen and we can start right after. Can all of you see my screen?
Yes, we can. Thank you.
All right. So I just want to thank you, Julian, for the introduction. That was very useful. And I just want to say a few words before we start. Let's keep the session as informal as possible. I have some really wonderful links to systems thinking and how it's useful in the real world. So I'll drop them in the chat as and when or after the session or something like that. And let's keep it super informal. I think you're all of my age. So let's keep it super informal. And I'm just going to share my journey and experience as we move forward. I want to start with saying that I'm a design researcher and I work at this company called as Quicksand. So Quicksand is a design strategy and innovation consultancy, and it's headquartered in India. So there's work with global corporations, there's work with international development partners, and also entrepreneur projects. There are a lot of cultural events that we incubate and that we've brought together to form a community around arts and culture in India. And at the same time, we are a part of design research and strategy network that is called REACH. So it has partners from multiple countries that help us sort of bring together projects which have sort of multiple ends in each countries. And yeah, and one more thing why I've added the website here, because it has done a lot of, Quicksand has done a lot of public health projects with outcomes that have been multimedia, comic books, such design outcomes that would be really helpful in case you're sort of undertaking any project that, you know, has a very communication heavy outcome. But yeah, moving on to systems thinking and giving you an introduction. So starting off with, I will not say that I'm a very ardent systems thinker or I've studied the theory of systems thinking that heavily, but I can say that across my project, across my design journey that I've been on, so basically I have had a lot of projects wherein it has been a very vital approach to take. It has been a very vital approach to look at the project and at the problem statement through a systems thinking lens. So it has been more of application of systems thinking rather than getting into theory. So just to summarize systems thinking, it is a holistic approach to look and synthesize our surroundings, to understand how multiple systems are in play and function simultaneously. So let us just give you a brief idea. Let us understand three sorts of systems and how do we understand them through examples. So there are simple systems, complicated systems, and complex systems. So if you say simple systems, there is one solution to it. There's one question, one solution, and you have one way to go for it. When it comes to complicated system, there is one solution, but there are multiple paths that you can take. And then you look at complex system, it has multiple parts and multiple answers. So when we look at systems thinking and we're looking at problems like AMR especially, you view them as complex systems and not complicated systems. And let's understand this more better with examples. When we consider simple systems, we can say headlights of a car. Or complicate when we consider complicated system, it will be an entire car. And when we consider complex system, it's a traffic jam. One more example for it would be your limbs, which are simple systems. If you break your hand, you have to fix it. Your human body, the aim is to live, but you can have multiple problems that you'll have to tackle just so you can live. And complex systems is society. As humans, we have biases. We come from, there's diversity, there's inclusivity, we come from different countries, we have our differences. So all that together is complex systems. And based on these systems distinction, we can also look at the problems that we want to tackle. So we have well structured problems, we have ill structured problems, and towards the end we have wicked problems. When you look at your problems or your problem statements through these lenses, you'll realize that you're taking an approach that goes from macro to micro. When you look at wicked problems, you're considering a lot of systems together. You're considering, well, let's say a wicked problem like AMR, you're just starting off with AMR, you'll realize that there are problems in so many areas like healthcare systems, food systems, animal healthcare, environmental healthcare. So you're looking at all this, and the lens you're looking at it is very macro, it's huge. But when you focus, keep on going, moving further, and describe clearly what you want to focus on, you pick up a focus point, you're looking very micro. So your problem over a course of time with your research moves on from wicked problems to well structured problems that you will then have the bandwidth and the capability to focus on and derive the most optimum solution. So in my practice also, we've always moved on from looking at this macro lens of issues to focusing on a problem that is within our capacity to achieve the solution for. So what are the characteristics of systems? What is the basic keywords and sort of ideas to keep in mind when we're looking at systems? So first thing is, everything is connected. A simple example of that is someone in other country ate a bat and now everyone is wearing masks. We're looking at systems that are all like, this is a system that is completely connected. Julian mentioned that I have to go somewhere, I have to go to my convocation actually, and it is online. Why? It's not because it was supposed to be online, but all of it is connected. One major thing is going to influence a lot of smaller things in someone's life. There is interaction and dependence. All these systems interact with each other. Healthcare systems, food systems. During COVID pandemic in India itself, we have seen so many issues of not just food shortage, food wastage. At the same time, we've seen issues that were societal in nature, the mental health issues that came together. So there is this interaction and dependence between systems that a change brings about. There is functioning as a whole, which is the next characteristic, which is this entire system functions as one thing. We function as humans. All of us together are as humans, but at the same time, we have many components. We have what we've created. We have how are we with others. We have our own characteristics, individuality, and plus how we are in the social world. Moving forward, what are the characteristics of complex systems? So basically, what do we keep in mind when we're looking at systems like AMR, when we're looking at systems that have too many focus points, wherein we can easily get confused of what we should focus on, of how we should solve it, because it is very overwhelming that there are so many solutions. We cannot stop AMR. We'll have to slow it down. We have to make sure that it doesn't accelerate. We have to look at human behaviors. We have to look at natural phenomena that are happening. So it is very overwhelming. So what are the things that we keep in mind to make sure that it doesn't really overwhelm us, it doesn't really scare us to look at something that is as magnanimous as AMR? So one thing is that the behavior of a system cannot be deduced by the study of its component parts. So sum of all, it's still more, it's not equal to the whole system. There is something else between those components, and their interconnections also, that is important. And the outcome of a system preferably has multiple benefits. A phrase to explain this can be to kill a bird with one stone. So when you look at complex systems, you cannot say that there's one linear solution for it. I cannot say that I will create one thing that will solve AMR. That's saying that it's linear in nature. It's A to B and my problem is solved, but it does not work like that. You have to consider that, coming to the most optimum solution is saying that I will devise one tiny solution, but I'll make sure that it's the most optimum solution one can devise the situation that I'm in. So moving forward, I'll talk about a complex system and let's understand this. So I'm giving you an example of India, but I hope you understand that our countries are very similar. We all have been through colonization by Western countries, and we all have struggled to look at identity, where we belong, and what are we, and we have similar issues as countries. We have discriminations in our country and things like that, and we have this idea of society that is hanging over our heads. So India has about 600 million people without access to basic sanitation services, and the question here to ask is that how do we ensure responsible use of use of toilets being built? So you building toilets is not a problem, but how do we ensure the use? So here it's not only infrastructure, but also how people see the use of toilets. What is the intrinsic approach and apprehensions towards using a toilet, things like that. And also India is one of the lowest density of health workforce, and the density of physicians and nurses is quite less in general with the statistics that are given. So there is clearly the concept of healthcare is not very, it's not taken very seriously. So how do we stress that the concept of health is people's right? So there are these very, very simple basic questions that make you question, that overwhelm you, that you're looking at a system that has too many sides, that has too many directions to move into. How do we tackle the disparities, the inequalities, the lack of access that is there simply in healthcare solutions? So all of these form different parts and different legs of a system that are interconnected. So these are complex system, and there are multiple similar challenges. There is the challenge of behavior. What are the motivations and incentives that drive a person's behavior? Where is the heart of change that we're looking to bring about? Then there is behavior of technology. In India, when we're looking at these solutions around healthcare, pitching a solution of tech, it really doesn't make sense, because less than half of India sort of is not very well versed with tech solutions. Then there is challenge of policy. So promising inventions in these sectors cannot be done without stirring policy. Like government incentives are very important because they come from a place of authority. They come from a place of a regulatory body that you can trust. There is also the challenge of systems at the end. So there is this understanding of stakeholders and relationships across people that one needs to take into account, that when you have to be considerate of everyone that is involved in the system. And then there's the challenge of patience. With systems thinking, there are delays. There is the need to understand that nothing can be, done. You click and you look for the solution and you apply it, and you want the change to be made. You want your purpose to be achieved. But what happens with systems is that you have to give it time to process. You have to give it time to, take place, get into the system and multiple other systems that are working, and then see the solution that it comes forth. Now let's try to look at systems thinking as something that we can apply in our practice. This was what I talked about earlier, was around systems thinking, looking at systems thinking in the real world, like healthcare challenges. How do you make sure that what is the difference between problem systems? Now let's try to apply systems thinking. So for systems thinking in real world, we first of all need to have a participatory approach, because it helps involve everyone that is in the process. And we need to understand the need for behavior change. So for any problem, we need to understand what are the behavior change, sort of the kind of behavior change we'll need in people. We need to understand what sort of strategies we need to apply, the policies that we'll have to change, and the infrastructure that we'll have to change. So there are many considerations when we're looking at the problem from a systems thinking lens and moving towards now something that is very focused. And how do we do it? So the first thing is to look at the interconnectedness, to sort of assume that yes, everything is connected and we cannot leave any stone unturned or any corner that is not looked upon. There is the need to understand emergence. Emergence is what is the outcome of something, happens because of something, what is the result of something. So in simple words, let's say the OTC sale of drugs, over the counter sale of drugs, what happens because of that? Why does it happen? So we have to keep that in mind. In India, there's also privatization, that is super expensive. What happens because of privatization? There are malpractices. So we need to understand that, there is a reason something happens because of something. So emergence is looking at how these outcomes emerge, to look at a flow of what happens because of what. There is synthesis to try and understand these flows. Okay, so this is how it happens. How can we mitigate it? What is the best way to stop OTC? And then there are feedback loops. So feedback loops are basically that, so when, like, simple example of when you have private and public sector, and with privatization, picking up pace, there is a vast gap in how our health services are. With private, it is on a very different level, and with public, it's still very it's still problematic in nature. It's still not efficient enough. It's not adequate for the kind of population that we have. So what feedback loops are is basically the richer gets richer, the poorer gets poorer, and that loop keeps on moving forward. And then there is causality, is to understand why a system is functioning the way it is, and everything that is responsible for it, and the drivers in that. So what is driving the causality of the system? And finally, the systems mapping. I think also because I'm biased, I am from design, and we have visual communication as one of our tools to sort of try and put forth our ideas. I do feel like systems mapping is very important because it gives you an idea of what you're looking at. To have everything on paper or on your screen that you'll have to look at and in front of you, you will be more considerate of everything that is, and you look at it as a whole. So we will talk about this further. And again, to help you apply systems thinking in your project, let's discuss habits of a systems thinker. So if you are a systems thinker, ideally, how should your attitude be towards the kind of projects or problems you're tackling? So you have to seek to look at the bigger picture. You have to observe trends and patterns over a time. So this problem, you need to look at it from the very beginning. You need to see when did it originate, how did it change over time. You need to understand that the system's generator is its behavior. How does it function? Like I mentioned multiple times, I mentioned that the human behavior is super important. There are things that are happening a certain way because humans behave in a certain way. They identify the circular nature and interdependencies. Like I said, the interconnections, make meaningful connections within the system. Try to identify these connections and how they're connected, and you build upon those. Resist the urge to come to quick solutions. Like I said, patience and perseverance are super, super important to build a solution that will be the most optimum. It may not show results quite quickly, but it will be very essential for the long run. Then there is surface and test assumptions, which is to try out things, to prototype it, to make sure that you're not just building towards something in isolation. You're trying things out with everyone. You change perspectives for better understanding. You understand how mental models affect reality, and we'll talk about that as well. Check results and changes action. So basically understanding that if you're creating something, how does it change, how will it, how do you sort of speculate that it will grow over a course of time. So your solutions need to be very well rounded. Recognize the impact of time delays. Like I mentioned, that it will take time for something to change. It's not a quick fix, like it was mentioned. Consider the short-term, long-term, and unintended consequences. So every solution that you do, it might solve a problem, but it'll also bring up a new problem. And I have really good resources to explain that. So I'll send those videos to you that you can check on, and they're very interesting. They're not kind of like lectures. but they're like cute animations and stories. So they're very, very interesting. And we pay attention to accumulations and rates of change. So there are changes that happen over a course of time. An example of that is climate change. So you see the changes that are happening over a time, and you design solutions with that in mind. And last is understand the system structure and leverage points. And we'll discuss the leverage points later as well. It has a lot of aspects. The leverage points are basically the kind of aspects you have in which system functions, the kind of constants that you look at while talking about a system. So this is one of the activities that I wanted to discuss. We don't have to do it now. You don't have to do it now. But if you want, you can take a screen grab and I'll explain it to you. So this is the iceberg model. It helps you understand the levels of perspective of something. So here, what will happen is you'll understand how a problem is functioning. So on the top that you see the event, that is your problem or your problem statement, or the kind of thing that you want to tackle. So when we look at when we go down below, so you understand the entire iceberg, you look at three sort of divides, which are patterns, structures, and mental models. So when you look at patterns, you try to understand that what sort of pattern does this problem follow. So like I mentioned, you'll have to look at since how long is it happening? Is it a regular event? Can we speak of a pattern here? Then there is structures. Structures is basically understanding that what causes these patterns. So what sort of political issues that does it, what sort of problem that do this problem is impacted by. So is it political, it's economical, ecological, geographical, industrial. So we try to sort of find the causality around the problems. And last is mental models, to look at the human connection. So what are the deeply rooted beliefs of people around this problem? Like, why is it happening? So what happens with something like this, it helps you give perspective to the kind of problem you're looking at. You look at it from a lens from when it's happening. You look at the all sorts of structures that sort of are making sure that the problem is accelerated. And then you're looking at the kind of approach and attitude humans have or have been having towards this problem. Like if you want to change that, so or you want to change any structure, or you want to sort of work on the pattern, is then on you to form a very sort of to devise something that you can eventually focus on. So it helps you make your problem from a wicked problem, that is this entire diagram, to focusing on one thing, which then becomes a well structured problem. Then there is, like I mentioned, systems mapping. So there are different types of mappings that you can start off with for your as simple as your problem, maybe, or as complicated. So you have geographical mapping, so you can understand your problem through different places or how it happens. There is network mapping, so you can start connecting things and understand how they're connected to each other. And there is process map of understanding that how are things happening in an order. So what happens here is that sort of mapping will help you understand how things are interconnected. You will have it in front of you. You will understand that how things evolve from one to the other, how they're connected to each other. And which I do feel like with mapping, you can capture the essence of how things are connected and essentially systems thinking as a whole. So now that we've talked about how systems thinking works and the kind of processes and the kind of tools that you could use, I want to take you through the AMR project process that I followed over the past 10 months last year to build out a toolkit, and then we can move forward to questions, but I think it's going to be quite short. So basically, I started off with understanding AMR because I come from a design background. So I didn't know what was AMR essentially. So I started off with understanding AMR, and after the very first few readings, I realized that there is no linear solution. It's very circular in nature. It is very confusing for someone like me who is not an expert in anything. So I tried to I tried to understand the Indian context of what I was looking at. I tried to understand the healthcare systems of what may be accelerating AMR, understanding not just healthcare systems, but also food systems. Because one of the approaches of One Health is One Health that is laid by WHO is very synonymous with systems thinking. Even One Health asks you to be very it asks you to be very cautious about how you're designing solutions. It wants you to look at animal health, human health, and environmental health together. So what I did was to understand how it has emphasized on interdependency and how it connects to human health. All you see are these maps is, it's sort of come after a lot of research and a lot of post-it notes here and there to sort of put together a map that will help me understand AMR. So basically, when I was putting forth the spread of antibiotic resistance, I was understanding that how can things relate to each other? How can we relate environment to, prescriptions, to antibiotics, to lifestyle, to disposal, to nutrition? And in somehow this entire system of way it functions right now, it is still accelerating AMR. So it was now on us and on you and people like you and me to decide where we want to work on, whether we want to work on the awareness, whether we want to work on something that is around human behaviors or environmental change or animal health or something like that. Everything is on us and how we choose to take our practice forward. Then again, moving forward to understanding causality and stakeholders of the system. System thinking follows a very it is a theory after all, so it follows a very simple process of moving forth. So when I understood causality, there were two ways to go about it. There was understanding the behaviors that were responsible for antibiotic resistance, and then there were drivers of behaviors, like we talked about in the iceberg model, mental models. So what was driving these behaviors of people that were causing these issues? And there was also understanding the different stakeholders. So it's not just doctors, or it's not just one sort of people, right? It is all of us. So I tried to divide the stakeholders into four different. So producers, that were pharmaceutical companies. There were regulators, so policy makers, health organizations, education. So there were consumers, which is patients, families, animals, environment, or everyone who's going to face the wrath of this problem. And then there are facilitators, so people who have the onus of communicating this, so like pharmacists, research and development people, medical practitioners. And you now want to bring these stakeholders together and see the kind of ecosystem that they're all connected in. So how are your policymakers and consumers connected, through monitoring and evaluation, through awareness activities? How are your facilitators and consumers related? So that is through, prescription patterns, telling, awareness about drugs and things like that. And then you have your pharmaceutical company, that is producers and regulators. How are they interrelated? Which is ethical policies, patent policies, fair use of drugs, the basic access to drugs and vaccines. And we have seen that happening. We imagine producing so many vaccines, and the kind of disparity we see now, that we have a program like COVAX to make sure that the rich countries are sending the vaccines to poor countries. So there's a clear disparity right now also in the way we are functioning and the way world is functioning. Moving forward, like I said, that we'll mention the leverage points in a system, but there was to understand that the global action plan for AMR already has a very common set of solutions that one can focus on. And I also think that it was very helpful for me as well to focus on this. So there was infection prevention and control, research and innovation, use of antimicrobials, awareness and understanding, and the overall surveillance on AMR. So these were the common points that I tried to map out together and see that and since I was a design student, I looked at places where I could create a difference. So I was now moving from this macro problem and focusing on things that were within my capacity of trying to make a change. And then looking at the leverage points in a system. So I'll give you a brief overview. These leverage points are from a book called as A Primer in Systems Thinking by Donella Meadows. She's an environmentalist, and she's done some excellent work in making people understand the systems theory and trying to look at it from a certain sense of approach. So she has talked about what are the constants in the system, what are the buffer sizes, what is the information flow in the system, what is the evolution, what is the feedback loops, negative feedback loops, material flows through the structure, goals, transcend paradigms, rules. So I mean, to explain further, it'll be very it'll take too much time. But what I did overall my project, I tried to understand constants and their relevance in AMR. So what are we looking at when we consider AMR? Then delays. So how does it's relevant to AMR? So one of the example was time taken between a policy made and its implementation, evaluation, and the purpose that it solved. Because we've seen that in because I've seen that in India quite a lot. The government makes a policy, but when you by the time it reaches to the people, there is a certain sense of apprehension, hesitancy, and it ends up not communicating and it ends up not working. So there is that delay, and it is caused by a certain sense of factors. So you're looking at all these things that that build up a system, and things like this, like these leverage points, really help you build out your process even more, and I can share them with you definitely later on. Now moving on to a little bit about design, where how I moved from a very systems thinking approach to a design thinking approach. So I tried to understand that what are my inquiries around AMR. What do I want to look at? Communication? Do I want to look at information representation? Do I want to since I'm a product design graduate, do I want to look at diagnosis methods? Do I want to make toolkits sort of for the products? For that, there is looking at global and local avenues. How do I want to impact? Am I looking at something that's very standardized and global in nature, or am I looking at like a really tiny set of sample size that is in my country or wherever I'm living? So so I looked at regulation, behaviors, and prevention around AMR. And just to take you through levels of design and understand it more, there are 4 levels of design that are talked about by a lot of people who have been into design thinking. This one is by Richard Buchan. He talks about 4 levels of design, which is traditional, product and service, organizational, and social change. So when we talk of traditional, it's mostly form and function. So there's communication, there's toolkit, so it's change in how you're representing information. There is product and service, which is understanding interventions around how creating a service. So let's say a different kind of service surveillance method, or a different kind of packaging intervention for antibiotics, that you make sure that this is something that you cannot mess around with. In India, we had a similar campaign called as the red line campaign, if I'm not wrong, which had all these drugs would have a red line that you can't, these are antibiotics that you cannot sort of mess around with. Then there's organizational change. So it's basically to understand that how do we change our organization structure as such that it decelerates AMR. And then finally there is social change. So social change is something that where you involve all the stakeholders. It is more of a participatory research to tackle AMR. So everyone is a very, very well-rounded solution, and it is the solution that will take the longest. And this is something that it is again synchronous to systems thinking, because you're taking into account everyone. So you're having facilitators, you're having doctors, you're having the patients, you're having the policy makers who see this process of yours and decide what sort of changes that they would like to make. So it leads to a lot of awareness because you have the people involved. A lot of policy change because you have the policy makers who are seeing this, and a lot of others who will help you build it. So if it's research methods and everyone, you have researchers and development people also in picture. So that is one of the most difficult to achieve, but at the same time the most optimum solution that you can look at with the maximum impact. So we started off with one of our first deliverables was to understand that that we had identified that One Health approach and systems thinking are very synchronous. How do we design communication tools around AMR that encourage discussions that are sort of follow the same practice as the One Health approach? So we tried to create a design sprint on this software called as Miro board, where multiple people can come together and collaborate to understand that if people work in groups from different sectors, can they try to have a sprint of designing solutions that are very, very well rounded. So then moving forward, we tried to create communication tools around AMR and with One Health in mind. So we had this cube of causality. So on 6 sides you have the behaviors and drivers of antibiotic resistance and how each of the side is connected to each other. Then there were incremental narratives, which was understanding our daily habits and what do we do, add a little to it so that it becomes better. So how your daily behaviors can impact AMR. And finally, there was this heavy focus on One Health mapping, was to understand that if we're devising a solution, can we keep in mind the stakeholders? Can we keep in mind this strategies that we're applying? Can we keep in mind the kind of changes that we want? And how does it make an impact? Like, let's say my solution in human health, how does it impact animal health and environmental health? And it may not, it just may not, but I still have to be mindful, and I still have to consider the entire system. So we had this blueprint that you see, like the two people working on that, that had probes, that had kind of divisions that people could write their notes on and understand that how can we sort of improve the way we're looking at the problems, make them more holistic, make our approach more holistic in nature and not be very unidirectional. And finally, like Julian talked about the biosecurity toolkit, so we'll discuss a little bit about the process there as well. So when we started off with biosecurity and disease prevention, there it was not just to go ahead and make the toolkit because it's asked for. It was to understand that why are we making a toolkit for biosecurity? What are the kind of goals that we're envisioning for India? We want to promote research and development. We want to promote awareness and approach to to poultry. That what the kind of thing, the focus point was poultry there, and it was basically in south of India. So we wanted to look at the policy making and implementation and the process. And but we were trying to understand that there is the sense of biosecurity culture, that my farm follows all of it. So how do you develop and how do you generate that sort of onus amongst the people who, like, amongst the farmers who are actually in this practice? So we tried to sort of speculate it over a course of time, a roadmap for biosecurity culture. We tried to understand that how can we design our research and strategy around it? How can we sort of understand dissemination and design of the research around biosecurity, the activities around biosecurity? How do we make sure that there are local and indigenous ways to tackle them? How do we look at collaborations and engagements? So not just the farmers, but farmers unions, there are other people who are involved in biosecurity, the products that after all you use in biosecurity. How do we involve everyone in this? So from government to people in research, people in design, and how do these come together to help us build a biosecurity culture? So there was looking at campaigns, strategies, there was looking at monitoring and evaluation, that over a course of time whatever you're making should not just remain as something that you've done. It's just a very small step, it's not the end of the day. And finally, we did build a toolkit with we talked to farmers. We had this photo voice experiment with them. So we asked them to send us pictures of their farms. We sent questions to veterinarians. We tried to understand their approach and their understanding of why the farms are not the farms don't follow a sense of biosecurity and all the conditions that we mentioned. So we tried to divide our modules understanding from a lot of biosecurity toolkits that were already there and that were created, and also tried to understand that in a country like India, we were building not just on the toolkits that were there already or from one of the farmers. I think we're also looking at the cultural context. In a country like India, you have massive emphasis on community, on a sense of word of mouth, on a sense of coming together, a sense of everyone being a part of something big. So we were not aiming to just achieve something by making sure that it is being followed. We wanted to make sure that people were being enough involved, people were looking at their farm as something that they need to have the onus of making sure it does not there's no disease prevention. So we made sure that we had activities like map your farm. We had we made a framework to understand how can we avoid biosecurity. So we had identify, isolate, inform, and improve. So how do you identify diseases? How do you the first thing you do after that is isolate. then the next thing you do is you inform it to the nearest government authority or the diagnostic facility, and then you improve. You understand that what went wrong. Was it vaccination? Was it biosecurity factors, that which is why this happened, and how you try and make it better. There was also understanding the map your farm activity. That was basically understanding that is your farm biosecure. So you try and understand what are the different features like and aspects of your farm in terms of infrastructure and operations that are leading that or can lead to disease prevention. So the entire sort of toolkit was to make sure to not preach them something, but to to tell them that we're with you, and we can do this together, and it is on you that if you will be the reason why you won't have any diseases, or the next big pandemic is because of the kind of measures you will take eventually. So we had this sense of community and building on cooperatives that were already there. You don't want to go and disrupt something, and you don't want to create one solution. Now I cannot say that this is the solution to AMR, if of course it's not, but it is definitely a very, very tiny step in a system that is so huge. So it has still not achieved its purpose. It may not have solved anything, but the repeated sort of attempts that we all take as people who are working in AMR, it is definitely someday going to show a change. It's a sense of betterment that will take place over a course of time, because like I said earlier also, systems thinking is not a quick fix. So so I don't really see it as the biggest solution, or it's not better than any solution, but it is definitely a step towards making this better. And finally we did take it to poultry farms in India. We took them there, we showed it to people. We asked them how did they feel about it. We saw very similar posters that were already done, but it didn't, they were broken, they were torn. So we were like, that is where that it's a little bit of something that's people don't care about. So there was this sense of owners that was lacking, the sense of seriousness that I need to make sure. And we've been there, and we've realized that there are a lot of problems that are beyond our reach. There is bureaucracy, there is there is not enough government efforts that you can sort of support, that you can get supported by. So you realize that even though you've designed a solution, it's still not feasible enough for us to go ahead and apply it or see changes. So you have to be very, very patient with whatever you've made, and you have to understand that it's a very, very slow process of tackling a problem like AMR. So everything that you do is a step, and you have to keep going ahead till you actually see a change. But what is really nice is that you have these different domains like communication design and design thinking methods and participatory research and systems thinking that you're now able to apply to these domains like AMR and multiple domains even within AMRs, like food systems or healthcare systems. Um, and as a designer also, it's very, very useful to understand that now design is not just form and function, but it's also to facilitate these purposes that we're looking at. So yeah, I think for me it was really eye-opening the past 12 months that I've worked for AMR, and trying to reach out to more people and getting in touch with Daniel or even people like in other countries, and showing them the kind of practice that we're doing here, and we're trying to understand AMR in India. And it's super helpful, and the entire systems thinking approach just adds like a layer of a layer of being holistic to this as well. And yeah, I mean, thank you so much. It's been lovely speaking to you, and I'll add the links below. Thank you.
Thank you so much, Diane, for that loaded presentation. Very useful information. I was actually learning quite a lot as you were going through those slides. So I'm really glad we are recording this, because it will be very useful for the students to refer to because you really touched on a lot of things, including the habits of a systems thinker, how systems thinking is very key, especially for a complex problem such as AMR, where we have the food systems in the healthcare systems, and also understanding those, the visual representations of the causality of AMR were very interesting, and also shedding light on the process you went through coming up with the toolkit. Of course, and what I also like about it is you are also inspiring the students and telling them, hearing from your age mate, that of course this is a very complicated thing to do and a very slow process, we've been reminded. But the good part is, as Diani said, everything we do is a step. So you have to keep moving forward and try to do whatever you can, and at least using this system. So I think it's very good to help in actually breaking down such a complex problem, as you have shed light in your very good presentation. And thank you. She did mention that she will share also links in the chat. We'll also make sure that these are going to be put also in our Slack channel, that we put all the useful resources that we get, so that students can be able to refer to it later. So thank you so much. At this juncture, I'll hand over to my co-moderator, Daniel, who I know is a very close friend of yours as well. Diani, to just let us know whether there are any questions. He has been monitoring the chat for us. So over to you, Jan. I did see quite a number of very good comments coming through of people really appreciating the good presentation. Over to you, Daniel.
Yeah, thank you, Julian. Thank you so much, Diani, for the wonderful presentation. It's been a pleasure. I have always had that desire to invite you to one of our sessions, as I keep on telling you. No, we don't have questions today, Julian. I think I kind of understand it. It's a new concept to most of us, and you are trying to grasp it, and it's okay. But I hope we went through the videos that I shared, and also the ones that Diani has shared. So for now, maybe if you don't have a question, but after some time, after you go through the resources and you're able to synthesize this information, you can just share the questions directly to me or Julian, and we'll share them with Diani, and then she will respond. So let's have it as as a continuous learning process for this, because it's really important, especially for us to kind of apply systems thinking and design thinking. These are new concepts and technologies that can help us, come up with better models and solutions. Before we release Diani, I want just to share a story of, I hope you've had the level of expertise and and a deep understanding of, she's an expert in design thinking, and at such a young age, and this kind of a motivation to all of us, like you don't have to be that advanced. We have a lot of potential at this age, and we can really do much. What you just need to do is identify your interest area and focus so much on it, and interact and learn. A story about me and Diani, how we came to interact and everything. And you can see how influential, you will see how influential Diani is. So Diani's company, they work closely with Wellcome Trust. I know most of you kind of know Wellcome Trust, this big organization, this big donor. And they were kind of applying for a project, and they had been contacted by Wellcome Trust. And it was last year, and at such a young age, still an intern, Diani was leading the whole company in the project, in kind of the application and everything at such a young age. And even one of the meetings, they have so many people, but you will see even one of the meetings that they are attending was with the co-founder of the company, and him mentoring her. That tells us that even at this age, you can be able to do much. And in terms of much, I don't mean maybe going so much international, or going so much global, but it's the impact that you render, be it in your in your maybe home setting or in your institution, how how are you able to influence people, you know, the behavior change that you've been told about. Yeah, so let's keep learning. And thank you so much, Diani, for creating time. I know you have another engagement after this. And also for you, we really appreciate you coming today and sharing these concepts. And sure, we'll invite you for another session. And I'm really thankful. Thank you so much. Over to you, Julian. And
Great. Thank you so much, Daniel. And indeed, Diane is such an inspiration, as you had Daniel highlighting the great work that she's doing. And it's good that we are going to share these slides and also the recording, because it's very useful to go back to, as I mentioned earlier. So before we release you, Diane, do you have any closing remarks? Any words you'd want to share with your colleagues?
unmute, Diani.
Yeah, sorry. Yeah, I think I definitely feel that when I started off my work in AMR, I did feel very much like an outsider, because I do not come from a background that is anywhere close to AMR. I am essentially from design and from product design. So it's more for me about research, about moving to different projects and topics. But what I have realized is that with AMR, the community that React has built or Daniel has been working on, to spread awareness, to make sure that people know about it. It's massive and it's super helpful, to incubate your projects. I do not think that my whatever work I have done till now, it's happened because of the support from React Asia Pacific, or from Cohort Institute in Kerala in India. I just feel like with AMR projects that we are very lucky that we've already established these communities and these organizations that are working towards the organization, to working towards the awareness of AMR. So I mean, if you're all students, then yeah, I think this is something that you should really take advantage of. The kind of guidance that you'll get from React, from SAS Africa, from Daniel, I think it's immensely important, and it's great to be guided by people who have been working here. But yeah, I think there is a question, right?
Thank you, Diani.
Yes.
Yeah, I think there's just a question that has popped up from Saddam. Maybe we can answer this before you release you. And also, I forgot to share. Then is so modest. She won a national award on design thinking. So congratulations, Diani. So
Thank you so much. Saddam, would you like to talk about your question a little more? If you want to speak, please go ahead.
Good morning, everyone. My name is Kajuri Saddam from Makerere University. Concerning the opportunity given by the Innovate for Africa, we are a team of 4, and we have come up with an innovation to stop the consumption of chicken contaminated with antibiotics in the society. Different people consume chicken after antibiotic treatment failure. And then also, most people at parties in Africa, particularly in Uganda, just buy ready to eat chicken at parties, whereby they wait for the day of the party, and then they go and purchase chicken in high numbers from the poultry producers. And yet these chicken, most of the times they feed on antibiotics in water, and then feeds as the growth promoters, So we have come up with an innovation, at least to extend our service to educate to these people about the dangers concerning eating chicken that actually contain antibiotics in their bodies. So we have resorted to using extension services, like we go to communities, teach them, and then we use brochures, we use posters, you know, as a behavior change to these people. My question is, are these means of extending our work sufficient enough to convince these people to change? Thank you.
Yeah, thanks for your question, Saddam. I also get scared quite a lot thinking that will brochures be enough, will posters be enough. I think there can be an inquiry into understanding that why people, they consume chicken without observation of withdrawal periods. Are they in a hurry? Are the parties more important? What sort of parties are we talking about here? So I know it's a little going off track, but I think it'll really help you understand that what is the behavior of people around around the consumption of chicken. So one thing that you can do is to understand where could you put these posters and brochures for them to work. So you can conduct very individual workshops, but here you're looking at things that are happening at parties, at homes, in general public. So do you think there'll be a smarter place to put up these posters wherein people buy their stuff for parties, maybe in grocery stores or party stores? Because here you're trying to tap into a ritual that is already happening. If your food, your parties, your general publics, these are things that people keep on doing since a long time. So the behavior is very intrinsic to them. So it may not work with like a very isolated workshop that you do, but it can work with something that you come up in the process, like when they go to buy something for the party, or when they go to buy in general. Can there be a poster there, or can there be an understanding with the person who sells chicken that you have to talk to people and just ask them that when are you going to consume it? So things like that. So I think it might be useful for you to tap into the behavior of people around it and why they're doing this in a certain way, and then maybe apply your posters or your solution somewhere that it can create a change in a very different manner. I hope that is helpful. I'm not sure if I've understood it correctly.
Yeah, I have gotten it. Thank you.
You're welcome.
All right, thank you so much. I don't know whether there is another question. I don't think we've got any other question, but again, thank you so much, Danny. And I think even as students go through trying to come up with innovative ways of addressing AMR, at least if there are any questions, especially looking at the design systems thinking way, it will be also good to just reach out to Diani, because she really has a lot of expertise around that area. So we can always then keep in touch after this and keep the conversation going. Before you go, we can just take a screenshot if people don't mind switching on their cameras before we excuse you for your next session. All right. All right, thank you so much. And thanks again, Diani, for making time. I know you had another commitment, but you actually came in and gave us some of your time to at least inspire your fellow students so that at least they're also motivated to act. And as you said, very complicated process, very slow, but we keep moving. And I'm sure at the end, there will be at least some change that we'll see. So thank you so much. I think at this juncture, we can excuse you unless Daniel, you have anything to say before she leaves.
Not really. Thank you. It's just appreciation. Thank you so much, Diane, for for making the time, and it's always a pleasure having you. Yeah, and I'm also a student of design. I'm trying also to see how I can also learn from her. Yeah, so thank you all, and have a wonderful day ahead, Diane. And
Thank you so much for inviting me. I can leave now. Is that okay? Yeah.
Yes,
Oh,
perfectly fine. Bye-bye, and thanks.
yeah.
All right. Yeah, so we will be moving to our next session now, where we are having the breakout sessions. We don't want to take so much time so that we finish on time. So we have 4 groups that have been formed. I think we'll be having around 10 participants per group. And as usual, when you get into your groups, you can just quickly volunteer to be either the chair to just moderate the session and facilitate the discussion, or we also need a rapporteur who will just capture the main points. I know it's very limited time to come up with a lot of points regarding in answering your question, since you have realized how complex this process is. Even if you look at some of the slides that Diani was going through, what she went through in trying to design the project. And I'm happy that even for the Innovate for Health, that one of you actually mentioned that they were in one of the questions. I think we did get a question where we had Saddam asking about the innovation that they are sending, and I had quite a number of queries as well regarding that competition. It's unfortunate that it's about to come to an end, so we are just reminding you, but we've been posting a lot via Slack and also the WhatsApp group. We've been talking about it. This is an annual competition that React actually does. It's in collaboration with other partners. I'll share with you just a 1-minute video so that you can just get an appreciation of the summary of what it's about. But it's encouraging to see that quite a number of you actually send in their applications. The deadline is tomorrow. And so I'll just share this video. Soon after that, Daniel will give us a brief of how the breakout sessions will go. And then my colleague who's with us, Musonda, will assign us into the groups soon after Daniel gives some remarks. So I'll just share quickly about Innovate for AMR. So all the best to all the students who have applied, and those that maybe will send their applications by tomorrow, because I know some of you have been working on something. So all the best for that, and be on the lookout since this comes through every year. So Daniel, any words before Musonda assigns us to the groups?
Yeah, thank you so much, Julian. In fact, I'm just trying to share the Google documents here. Yeah, so Today, I hope you also the questions. I shared them yesterday. So, because we are not so many, so we won't have like 6 groups as such. So today, about the question, you don't have to go so much into depth, like come up with a whole innovation or something. We just want to kind of see the steps that you would take if you have a certain if you have a certain way of addressing one of the problems that has been cited. And this is important because it helps us try get the understanding on design thinking and also the sharing of ideas, because at least when we all phrase it differently, then it also becomes easier to understand. So I've shared the Google the links to the Google documents that we'll use. So we'll the rapporteur will indicate our names there, and then we'll type in the major points from the discussion. You don't have to type so much, just the key points. Then we'll request that one of the persons in the group can share their screen when the group leader or the rapporteur is presenting, so that at least it also helps when people kind of see what you're presenting. It helps in reception of that and also in the understanding. Yeah. So let's feel free. It's an open forum. Today is just ideas, and yeah. So let's discuss and let's see what we can come up with. Yeah. So thank you, Julia.
Yeah, thanks, Daniel. So we'll have 4 groups, which Musonda will assign us to. So 5, you can just ignore group 5 and 6 for now, but there are some more questions. They've been also shared in our WhatsApp and Slack channels. But so group 1 will look at, you just go to your group there. That's where you see the question that's there, group 2, group 3, and group 4, like that. So Musonda, we are good to go.
Thank you. I'm assigning just now. I'll be opening the rooms.
Thank you. Oh, sorry. And we have 30 minutes for the discussions. So at 10:50, that's Kenyan time. We'll just reconvene and give each group 5 minutes to just share a very brief summary, so that at least by 11:10 we'll have concluded the session. We don't want to go too much past time. Thank you.
Hey, good morning, everyone.
Hi, Saddam. Sorry, Musonda, thank you so much. I can see there are still some participants in the main. Okay, yeah. I think just a minute, Musonda is assigning you to groups.
Okay.
Yeah, Saddam, just a few seconds, you should be joining a group in a few.
Hello, Julian. Hello.
Hi, Musonda. I can
Hi.
see.
So the ones who have not yet, everyone has been assigned a group, they need to accept where I think there should be a notification that is asking them to join a particular group. Everyone has been assigned.
Okay.
So on my side, it's showing that they have not joined. That means they haven't accepted to join the group.
All right. Yeah. It looks like that's what we have here. Saddam, you're supposed to be in group 4. Can you just join group 4? Do you see any notification on your screen to join group 4? Saddam? I think it's because he's joined quite a number of times. I can see him twice here. I think he's having issues with the internet. Tanaka, you're supposed to be in group 1. Tanaka, can you hear me? I think he hasn't joined. And then Wanjiru, you are in group, let me just see. Wanjiru is supposed to be in group 4.
Julian, were you saying something? Sorry.
Sorry?
Were you saying something? I had gone to see what's happening in the other rooms.
No, I was just talking to the 3 that haven't joined groups, and I was wondering why. But I saw Saddam had joined twice. That could have been the reason. Tanaka is supposed to be in another group, but I didn't. He's supposed to be in group 1 actually, but I think he hasn't. And Saddam I still see him here, and Tanaka as well. But I think Wanjiru has joined. Yeah. Thank you, Musonda. It looks like people have now they have now gone to their rooms, except Tanaka. I don't know whether he can hear us. I think he might be having internet issues. So we are good to go, Musonda. Musonda, can you hear me?
Yes, I can hear you. Everything's okay?
Everything is okay, yeah.
Okay, thank you. Bye.
All right, bye.
Julian, I have failed whenever I try to log in into a group, they just push me out. I don't know.
Oh, I think you had joined twice, Saddam. Just wait. Let me assign you to a group. Just a minute. The one with the list is room 3. So I have sent you to room 3. Saddam, you should be able to join that one. Do you get any notification of join room 3? Are you getting that? Saddam? Saddam, can you hear me? Hi, Saddam. Saddam, can you hear me? Hi, Saddam. I think you're having some connection challenges. Saddam, it looks like you're facing internet challenges, right? I see you're back again to plenary. All right, welcome back, design thinkers. I could hear some interesting discussions going through in the room, in the various groups. So I'll hand over to Daniel to just moderate the session quickly so that each group just gives 5 minutes presentation. Over to you, Daniel. Daniel? It looks like Daniel is having internet challenges, but group one, are you ready?
I think we are ready. I think the secretary can now come in to give us what we discuss in our group. Thank you, Secretary. You are welcome.
Thanks, Alex.
Good morning, everyone.
Good morning, Karen. We can hear you. And when you start, just introduce yourself and also your institution and country, because it's good to also hear the new voices that I'm seeing now, so that the rest of the students also are aware where you're joining from. Thanks, Karen.
Right.
Go ahead.
Yes, I'm Nanda Gotekla Karen from Makerere University, Uganda. I'll be sharing our main points in group one. Let me try to share my screen. Okay.
Are you able to do so? Or
no?
You are not able to. Let me just, you should be able to now. Just try again.
Okay.
Yeah, because it's easier for us to be seeing your screen so that we can follow the question as well. Yeah.
All right. You can see my screen?
Yes, yes, we can see your screen now.
Our question was, you plan to conduct an AMR awareness session.
It looks like sorry. Oh yeah, now we can see the question. Go ahead, sorry.
Okay. You plan to conduct an AMR awareness session in an informal urban settlement that is closer to your institution. How would you apply design thinking to develop awareness materials that are context specific and sensitive to the needs of the people living in these settlements? Consider the average characteristics of an informal urban settlement. So we first discussed the response. We discussed characteristics of informal urban settings, which are that they don't have resources, like they lack clean water, they lack adequate measures to ensure sanitation. There's poor toilet conditions, inadequate waste management, low nutrition value of foods, and poor housing. And we came to how to create awareness. We agreed that this is a complex system and we need to know the language that people use in the settlement and the average level of literacy. We have to first know how much the people understand antimicrobial resistance. Have they heard of it? Do they understand the concepts? Do they use antibiotics? Yes. And we agreed that would, as part of raising awareness, would conduct interviews from random numbers of people in the population in order to get like an average picture of everything from different angles and compile our findings together. Would then create ideas on how best we can address them. Would test run these ideas and choose which ones can best be applied. Then antimicrobial education, stewardship, and awareness should be explained to the population Then materials and lectures on those should be provided. So we agreed we would go door to door, yeah, in creating awareness. Then the steps, there was a supporting question was discuss some of the major steps you would consider in the process. Yes, so step one was to conduct a survey, yeah, which I explained in the process, and to mobilize people to come for our sessions. Yes, in groups. That's where we ended.
All right. Thank you so much, Karen, for that summary. And indeed, I think in order to raise awareness, as our presenter said, our main guest for today, I think things like that iceberg model that you saw, that actually looks at what are the underlying issues, breaking down the problem, which is very good. And at least you tried to look at what the issues are to do with WASH, like you were doing. And also, we should also remember that when we are mapping, you remember there were 3 areas that Diani also mentioned, where she was saying that we should look at the geographical location. Where is it that, where is our target, the network, what are the key stakeholders there in all those gaps, analyze it using a broad perspective, and then of course come up with the process that you are now focusing on. So thank you so much for that summary and for keeping time. We move over to group 2. Who is going to be presenting on behalf of, yeah, thank you.
Thank you very much, Julian. My voice is not new, but I'll be presenting on behalf of Group 2. My name is Roger Senyonjo from Bustema University in Uganda, currently in my final year. If you'd allow me to share my screen, Julian.
Yes, I have done that, Rogers. You should be able to share your screen.
Okay. Thank you. Please confirm that you can see my screen.
Yes, we can, Rogers. Kindly go
So
ahead.
these are the team members, our group members that were in group 2. We had Jime, Rogers, Ibrahim Katalega, Ignatius, Caroline, Martha, Mbusa, Ngabo, and Ritoch. I don't know whether I pronounced the name right. But our question was, you have realized that high school students in your locality have little knowledge and understanding of antimicrobial resistance. A thought strikes you that a game would be a good awareness tool for this demographic group. How would you utilize the design thinking approach in developing the game? And the supporting question is, share some of the basic steps that you would consider in the process. So we have, okay, I'm going to present at once. In my presentation, I'll be following the basic steps that you would actually consider. So from our discussion, we identified that we should be able to start with assessment, doing initial assessment. It's not so different from group 1. So in the assessment, we want to identify the game of interest for this population, this special population of high school children, that will help them understand the concept. And then still in assessment, we want to evaluate the knowledge and understanding of these students on antimicrobial resistance, and also want to understand the steps that we can consider for us to be able to deliver the game, to deliver the message through these games. And once we've identified the game, we'd like to give this game a theme based on the antimicrobial, the theme based on antimicrobial resistance. And before each game, we can at least be able to share a message about antimicrobial resistance or be able to deliver this message at the end of the game. So this is the point that I've highlighted about giving this game a theme. Then after that, I want to do system mapping. And here we're going to come up with different teams within the target population. For example, we can come up with team A competing with team B, or we can have 3 teams, 4 teams, depending on the population that we are targeting. And then after coming up with these teams, after mapping our system, our population, we want to bring out the component of interconnectivity. And here we're going to identify team leaders in each of these teams. So basically the team leaders will be to help us in here and there. First of all, we want to empower them. We want them to own the games, not to feel like we are doing it for them, but to feel like it's theirs and they're doing it for themselves. So that's the point of empowerment. And we want to also, these people help us in coordination of their peers to bring them to being involved completely and to the understanding. You know, one point that personally I believe in is for you to be able to win the race, you must be in the race. So after that, we want to bring out the point of synthesis, and this is how we are going to convey our information to the final consumers. So once we formed our teams, we can give these teams different sub-themes under our main theme, and they can come up with their different communication channels on how they're going to deliver the information, in addition to our messages that we shall be sharing maybe at the start of the game or at the end of the game. For example, they can come up with different flyers, posters, and banners. We can support them in coming up with these communication channels. Another thing is that we can come up with, or we can design educative games. Someone brought up a point of actually going digital. So I didn't give the examples of the games that we can come up. For example, football matches, it could be athletics, it could be MDD, that is music, dance, and drama. And then educative games, it could be mind games among this population. And we also we thought about forming of small antimicrobial resistance families and clubs that are led by teachers with knowledge on antimicrobial resistance. We realized that most of the science teachers and in the schools actually have some basic understanding about antimicrobial resistance. And then some of our final points is we must create a feedback loop where we ensure the understanding of the concept among students and also evaluation to identify the gaps. So once you've created your feedback loop, you're able to reassess after your game what has been your impact, and among these students, are they able to understand what you've really delivered to them? And then you identify the gaps and redesign for the future games or for the future interventions. And then lastly, we also want to ensure sustainability. Here I say sustainability of the game, but it could be sustainability of the approach. We can use different approaches, but ensure that this is actually something that is going to be recurring. Maybe every time we shall be having this game, and specifically the theme will be about antimicrobial resistance. So the game should be able to sustain the measures that we have to implement antimicrobial resistance and be able to apply for all the years. So basically, that's what we are able to come up with, and I've already introduced my group members. Thank you very much. Julian, back to you.
Thank you so much, Rogers, for that good summary. And it's interesting to see that every group just had over 20 minutes to quickly just look at the process. But I must say that it has really been very fruitful. So I think going forward, really, we are going to have a lot of brilliant ideas coming from all of you. And that's quite encouraging, even including aspects like the feedback loops. I think to this morning, Diane was saying, for the IEC materials that they developed for that biosecurity project, some of the farmers were just discarding, or the people in the community not really utilizing them. So I think the idea of the feedback loops you brought about, very important to make sure that you are tracking whether it would work, even at the point of designing, trying to involve as many stakeholders as possible, and also looking at sustainability, like you mentioned. Group 3. Who's presenting on behalf of Group 3? We can move over to Group 4 if they are not ready. Then we'll end with Group 3 in the interest of time. Is the presenter for Group 4 ready?
Hello.
Yes, Shamim. Shamim, you are presenting on behalf of which group?
Group 3.
Ah, good. Perfect. Please go ahead. Let me just allow you to share your screen. Yeah, you should be able to now. Thank you.
Okay. Are you able to hear me?
Yes,
Yes,
Shamim.
very loud
Yes.
and clear. Have we lost Shamim?
Yeah, I think she's just some network challenge. I think we have lost her.
Yeah, she seems to be having connection issues. Just like you're having this morning, Daniel, you're breaking.
Oh, sorry. Okay.
Yeah,
Am I?
but now I can hear you. Yeah.
Okay. Yeah. So I think maybe we can go to group 4, then we come back to group 3. Hello, Julian. You're on mute.
I'm sorry, my network is a bit poor. You moved on, or I can continue.
Yes, please go ahead, Shamim, on behalf of group 3. Shamim, can you hear us? Group 4, I suggest as Shamim sorts out the network issues, we can go to group 4 and then come back to Shamim. Group 4, are you ready?
Yes, group 4, our repertoire is, let me see if our repertoire is around.
Okay, yeah. Brian has just allowed you to share your screen, so you can go ahead and do so. Thank
I'm
you.
sorry, I'm sorry, I can't share my screen, but our repertoire is not around. I think.
Oh, okay, that's okay. You can just quickly let us know what you were looking at, the question, and then what you came up with.
Okay, thank you, Julian. Our question was, the disposal of antibiotics in both humans and animals has been a great challenge and is coupled with many uncertainties. So we are supposed to utilize the design thinking process to brainstorm on a novel intervention that could address this challenge. And we explain some of the major steps that we would consider in the process. So I see our repertoire is back. I don't know whether she's able to share. Shira, are you able to share your screen and will you take us through? Shira. Okay.
Yeah, I've just made a co-host. She should be able to now. Yeah.
Thank you so much. Shira, are you able to take us through, or I can continue and
Maybe, I think maybe Sheila is experiencing some network challenge. Are you able to hear me?
I'm hearing you.
Okay.
But I'm having difficulties with sharing the screen.
I'm let's
using the phone.
Okay. Yeah, but it's okay. If you're able to share the phone, it's okay. They can also use the phone, so it's just okay. We'll just read it as it's okay. You can just share. Or maybe you can just read for us what you captured. Is that okay?
Yeah, I can read for you what I captured.
Okay, thank you.
So our group our first intervention was our intervention is creating awareness among people about proper disposal. Then the key steps we would take, first of all, is identify the usual disposal mechanisms. How do people dispose the waste currently? Then the second step is, what is the ideal disposal mechanism? Then the third step is, what is the barrier to proper disposal mechanism? Then the third is identifying stakeholders involved in the championing of proper disposal mechanisms, such as the local leaders, the political leaders, such stakeholders. Then identifying the non-human resources needed, such as finance, in order to implement the solution. And lastly, implementing the solution, first of all, through advocacy about infection prevention and control, then also identify using materials such as brochures, posters, with proper usage of antibiotics, with information about proper usage of antibiotics. That's it.
Thank you. Oh, Daniel, you can go on. It's fine.
Oh, okay. Thank you so much, Sheila. Yeah, thank you for breaking it down. At least you captured what we were looking at. We did not want to kind of you to develop the model. We wanted you to tell us how you would develop the model. At least you have pointed out to some of the key areas, such as identification of the current behaviors and practices, and also researching on the on the ideals or the existing protocols of drug research and disposal. Then looking at the two, what are the barriers? Why don't people kind of dispose their drugs as needed? You remember, we'll also kind of use the same iceberg that Biani explained to us, so at least you have a deep understanding of the problem, and also you have looked at how you can work with different stakeholders. Yeah, and I think maybe something that maybe we would also look at is, before you implement the solution, it would be good to maybe kind of, after you understand the problem, then you ideate, like you think around what are the different interventions that you can apply, and for each intervention kind of addresses a specific part of the problem. So it would be good that as you also ideate on these solutions, you look at what component of the problem does it address. Yeah, so thank you so much. So maybe we can have someone maybe present for group 3 in place of Shamim. Maybe, or Shamim, are you back? I think Shamim is not yet here. So maybe another group member who was in the group can just share brief summary. Okay. Oh, Shamim, welcome. Yeah, Shamim, can go.
Are you able to hear me?
Yeah, we can hear
Yeah,
you
I'm so
clear.
sorry. My network is a bit poor, but let me try.
It's okay. Yeah, and maybe you don't have to share your screen, because it will kind of pull some.
Are you able to see my screen?
Not really.
Hello?
Hello, Shamim.
Hello?
Can you hear me?
Hello,
Shamim, can you hear us?
guys. Are you able to hear me?
Yeah, we can hear you clear. I'm saying you don't have to share your screen, but at least your network is not kind of
You are able to
diversified
hear
so
me?
much. Yeah, we can hear you.
I think we shall have another member to present the network as
Hello, Shamim. So maybe we could have another member of, maybe please confirm that you can still hear me. I also had some internet challenges a while back. I hope you can hear me. We
Yes,
can have,
Daniel, we can hear you loud and clear.
thank you. I almost thought that I was the one who was, the network was a bit off. So maybe someone else can present on behalf of Shamim so that we finish off. Please, a member of group 3 kindly. Hello.
Hi guys.
Hi, Lucy.
I'm Lucy from University of Nairobi. Yeah, Kenya. I'll try and take you through the question. Question 3.
Thank you, Lucy.
Our question was, as a practitioner in the hospital, you have been constantly worried about the rising resistant levels in the health facility. You have been keen to observe that the high resistant rates are mostly from hospital-acquired infections. The infection prevention and control measures are poorly implemented. We are thinking of an innovative idea that improves the levels of hand hygiene in the area. Discuss how we would apply the design thinking to develop this intervention. And the supporting question was, what are some of the factors that we'll consider? Explain the major steps you will take process. So we came up with the discussion. The factors to consider were, why is it that there is a hand hygiene problem? Is it that there are no materials for hand cleaning or sanitizing? Is it that people don't have knowledge on the importance of hand cleaning or hygiene? Is it that there is no water? So those were some of the factors we thought that could have led to maybe the handheld infections, hand acquired infections. Something else is how will we, what are the solutions to the problems? And we thought that sensitization can be carried out on the importance of hand hygiene, and also maybe find ways in which water can be supplied to the area or to the hospital. Also, hand sanitizers or the water hand washing points should be placed at a strategic place, maybe at the entrance of the hospital. Okay, and also guidelines should be set that will help with coping the hand hygiene. And also the hospital staffs, they can be, the hospital staff to also lead to, at some point, they can you hear me?
Yes, we can hear you.
We are following through. Thank you, Lucy. Continue.
Even the hospital staffs, or even them, they tend to be part of these hand-acquired infections. Maybe if they have dirty dust coats, maybe they're not changing their gloves, maybe they're not washing their hands after touching dirty surfaces. So, and then what are the factors we'll consider? Explain the major steps. The steps is analyze the problem. What is the problem? Then what are the solutions we can do to solve the problems? We can do this by setting maybe a committee, then that can discuss ideas, come up with results, come up with what is happening on the ground, then come up with innovations that can help to mitigate the issue. I think that's all. And if there's anything else that can be added by someone from the group, they can share if I've left out some. Thank you.
Thank you so much, Lucy. And also thank you so much for taking the initiative. It's one of the characteristics of a leader. I know you weren't prepared to present, but it's always good. Before maybe I talk a bit about the breakout sessions, thank you for pointing out to some of the procedures that you will use. And this question was it kind of narrowed down. It started from the high resistance levels, pointing out to the hospital acquired infections, and then it kind of offers you one specific problem of the whole of the whole setting. That now let's look at hand hygiene, because it would be one of the contributors. Then from that, then how can you develop interventions? And I would also maybe recap this once again. Also, as you identify the problem, it's also good to know that maybe even in these facilities, maybe they already have guidelines, and maybe at some point someone came and maybe also fixed some of the give out some sanitizers or fix some water points where you can maybe you wash your hands or something. So as you also think about the problem identification, it's also good that we dig a bit deeper, so that we have a clear understanding, even in terms of the behaviors, in terms of the perceptions, and look at what has been done before. This was done, why didn't it work? Where can we address? And also I love that you also pointed out to the aspect of it should be a collaborative process. As Diane shared, everyone should be engaged, right from the janitor to the to the doctor. Everyone, maybe any shortcomings in terms of infection prevention, maybe, or sanitation, it kind of affects the whole system. If maybe someone is the one cleaning up the room and doesn't do it correctly, then it should affect all of us. Maybe if it's the doctor, as you have said, who doesn't kind of use the, kind of follow the protocols. I would also love us to, there's a point that you have been leaving out, and that is the issue of, prototyping. It is good that, and prototyping doesn't mean that you develop like a concrete or a brick and mortar a product that you can touch, but also if you develop an intervention, it's good to test it out, maybe to a small population, that at least you are able to kind of correct it and know where do you need to adjust. So you could also, as you also develop solutions before we roll them out large scale. It will also good that we kind of also prototype. And in prototype, I mean user testing. Yeah, so maybe if you have developed this intervention, try it out on a small scale and see maybe how is it working, what do I need to correct. Then at least you'll be more informed even as you try to roll out maybe to the whole hospital facility. So yeah, team has gone quite much, but I believe it has been a very wonderful session, and I'm also happy that we have also shared some of the things that we learned that Diane shared. At least I was seeing them manifesting in our presentations. So maybe the reason why we have breakout sessions and these spark discussions where you don't know who you will discuss with is to kind of put us in our feet. As leaders, you need to be very flexible one, and also you need to, adjust to various positions very quickly. So maybe to save up on time, because I realized that sometimes you spend so much time, maybe delegating will become maybe the chair or the rapporteur, which is also good. But we have it that way so that at least it's also a learning process for you, so that we can all take up initiative. If we would go to a group and then everybody is like, oh, I'm the group leader, I'm the rapporteur, everyone wants to kind of volunteer or take the initiative, then this shows that at least we have all kind of embraced the concept, we're all gaining confidence, and we start small, and at least, believe I'm also learning in the process too. We're all learning, and so never shy about maybe taking the initiative, or maybe you feel that you don't know so much. So yeah, thank you so much. I have so much, but time is not on our end. So thank you so much also for making it to the session. I'll give the floor to Julian, and then I'll maybe share a bit about our next session. Then you can wind up. Thank you. Over to you, Julian.
Thank you so much, Daniel. And indeed, you've really wrapped up the session very well. And thank you to our leaders. Indeed, when we're discussing this assigning of rapporteurs and chair lady or man in the groups, we then said, no, let's just leave it like that, so that at least people have that volunteering spirit. And it was really shown, even as you said, some of the groups like Lucy jumped in quickly to say, let me just present on behalf of the group. And there was a lot of teamwork shown, even as others were also presenting. So thank you so much. And it is also encouraging that you came up with good steps, really, as I said before, when the groups were presenting, because this was a very short time, but it shows that at least you are really getting the idea and you are willing to actually act. And what I can just conclude by saying is something that we always say every time, that we are really depending on you. I think one of our speakers in one of the sessions, I think it was Dr. Emmanuel Kabali, who mentioned that we have failed as a generation. So we depend on you. So I'm hoping by the time we get you to be also the professionals in future, you are coming up with innovative ways, because you know where the gaps are. Like Daniel was mentioning, even the interconnectedness in a health facility of, say, how does a hospital-acquired infection come about? Is it hand hygiene practices, things like that? But what do we do about it? Because all the reports will be saying maybe people are not adhering to hand hygiene or IPC measures in the animal sector, biosecurity in our region. But what we don't want to keep saying the challenges, but let's do the small steps that even Diane mentioned, that it's very complex. It's not a quick fix, but the small steps will yield fruits in the end. So do not be discouraged, continue. And you never know, maybe that's an idea of yours that you're considering small might actually help a lot of low resource settings to actually change their way of behavior. I once gave an example of a pharmacist in a very low resource setting in Lesotho who started recording some adverse drug reactions for all her patients just as her own initiative. And that actually led to a lot of changes in the policy of the country. But she just started in a very small, very low level hospital doing that. So in whatever context you are in, you saw like our guest today, she's a designer, but she managed to get on to do AMR issues to an extent where she has done amazing things, both in the human aspect and also in the biosecurity project she was talking about for the poultry sector. So do not be discouraged and continue doing the great work. I'm so encouraged when I see such feedback coming from groups over a very short time. So well done to all of you. And thank you to all our rapporteurs, to all our chair, the people who volunteered to chair in the groups, and to all of you for participating, for taking time to come every single weekend. Next week, we do have our final session, like in terms of the capacity building sessions. The one on the 9th will just now be looking at making sure that you don't have any questions as you go in to do your designing of the project according to what the program said. You can refresh your mind if you look at what will that part of the program will entail, the one for October getting into November for the World Antimicrobial Awareness Week. So Daniel, you can quickly give a summary of our session that will happen next week, which will be the final one in these sessions of capacity building before we close.
Yeah, thank you so much, Julian. Thank you. As you have said, I'm really inspired, and at least we can see a lot of change. We can see a lot of impact manifesting. As I think I'd shared a bit a while back in the group. If you are thinking that you have an idea, something that you want to implement, and maybe it's kind of time constrained, you kind of have a small session to do it. You can just share. We'll see how we can help you with it, support you with it. At least we have some of us who have reached out and they have very wonderful ideas, and at least they're even passionate about doing it, and it's really great. As you have said, as Julian has said, we just step one step at a time, and yeah, we'll get there. So for next week, we'll kind of now it will be our wrap-up session, our webinar session. And as you've seen, the session started with, the basic knowledge on AMR. Then we kind of now started diversifying and tackling some of the skills that you require. So for next week, we'll start off with on project management and just some key aspects that can help you, come up with a project. But as you've already seen, we kind of even know these steps already from our brief presentations. You didn't to define the problem or anything. So you'll have a speaker who will kind of give us the theoretical input of it. What do you need to consider when you're coming up with a small project and everything. Then we'll have another speaker who will kind of detail now, showcase all this in a case presentation for a wonderful project that they have been doing in India with school children. A very wonderful project, and the results have been amazing. So yeah, so the essence of this session is to help us, gain this knowledge as we kind of develop our projects. As you remember, we said we'll have some group projects and some individual projects. So for the groups, we'll share more on the 9th about how we'll go about the group projects. But as you can see, we are almost approaching the time, so you can't. And as we said, for this one, I believe that I hope that as we have been going on with the session, at least you have reached out to one person or another. You remember David in the leadership session told us that it's good to know people who are within yourself, even in different countries. So I hope that you have been reaching out, so it won't be that much difficult to come up with a small group that you could engage. We want this to be, voluntary from your end. We don't have to kind of organize so much, because at least when you kind of people come up together, and at least you're able to complement each other in terms of strength, and maybe you have similar ideas, or you know how to complement the ideas that you have. But in case maybe you think you don't have that, you're not able to kind of get your group, you can just reach out as early as maybe next week, so that we can try seeing how we can maybe pair some of us to kind of come up with these groups. Yeah, so that's it about next session. We wrap up with project management and a case presentation. Then, as Julian has said, we'll have another session on the 9th. Thank you so much. Thank you so much, Rogers, for that. We'll offer details more on this about the group size and everything. But in the meantime, I was just saying, let's try, organize ourselves. But not so much big of a group. I'd say less than 5 people. Yeah, but we'll share more details on that. But at least just try to map out, different people that you can engage with at the moment, not kind of form the concrete group. Yeah. So thank you so much. So on 9th, that's when we'll kind of share everything about how we'll go about the project. Yeah, and after that, we'll now start the remote project work. And please also remember, we'll have an individual project during the World Antimicrobial Awareness Week, and we hope that we'll be able to share out the different activities that you've done with different students. Yeah. So thank you so much. And I think that's it. Yeah, so over to you, Julian. And thank you so much too for attending today's session. It's always a pleasure seeing us. I see the same faces over and over again. think I've known almost the 44 of us who attend the session now. So thank you so much. And
Yeah.
over to
Hello,
you,
Dan.
Julian.
Hello. Excuse. Can I speak a bit
Yeah,
before
Jimmy.
before Julian?
Yeah, Jimmy, you can
Okay.
go ahead.
Okay, good morning, everyone. We are so grateful for today's session. Actually, it has been a very nice session. Actually, we are so grateful for our guest today and also Julian, Daniel. We are so much grateful for today. Actually, you are playing a very important role to us, leading us through every time. And actually, we are learning a lot as leaders, as AMR leaders. I just wanted to remind us that we are going to have another session at 4. Just an introductory part on the processes of drug research and discovery. And actually, it will be a session that it will start at 4 up to 6. That's for 2 hours East African time. But now, actually, now we are inviting everyone, at least the AMR leaders, to participate in the same. Actually, it is very important because now we shall never. Let's not get tired of fighting against this health threat of antimicrobial resistance, because even the antimicrobial, it is also not getting tired. So we should not get it tired. Actually, we should stress much efforts on this in the efforts of fighting against this antimicrobial resistance. So mine is just a reminder. Let's all participate. We are all invited to join in the meeting as we start. Thank you so much.
Yeah, thank you. Thank you so much. Oh, over to you. Before I hand over to you, maybe thank you so much. I want to share, some of these lessons are very important. kind of. So thank you so much, Jimmy, for the reminder, yes. And it's quite a story. I think I'll share with us during the next session how this whole program of drug research and discovery came about. and Jimmy is the one who is leading the program, and he can manifest that he has been able to, connect with so many people in this field. And wow. So thank you. And he's one of the leaders that we look up to. So thank you so much. Over to you, Julian.
Thank you, Daniel, and thank you, Jimmy, for that reminder, because we all know that there's been a dry pipeline in the discovery and development of new antibiotics. So as I said, the young generation is who we are relying on for us to help in all this. I know Africa, there's been a lot of lagging behind. Dr. Gitao mentioned that even last week. There is no reason why, even for the vaccines, why we are now relying on COVAX, or we do have very intelligent and excellent resources around us. So I think going forward in the new generations, the next generations to come, if we can at least have that. So such programs, very, very key, Jimmy. So whoever is available, that would be good for you to attend and just also hear what will be going on regarding that. And so I don't have anything else, unless there is one burning thing. Is there someone who wants to say something before we close the session? If not, I don't see any hand. So thank you so much once again, and enjoy the rest of your weekend. We'll see you next week. Bye.
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 Bye-bye.